An MRI arthrogram is an imaging procedure designed to diagnose problems within a joint. An injection of a liquid contrast material into the joint space allows optimal evaluation of the joint during the MRI. An arthrogram is typically done for diagnostic problem-solving purposes. The most common joints studied are the shoulder, hip, knee, or wrist. Before your exam, a technologist will review with you the informed consent document, as well as any special preparations that may be required. The informed consent document provides an overview of the procedure, desired benefits, possible risks, and your rights as a patient. If you are viewing this video on our website, you can access the informed consent document under Patients. For this exam, no jewelry or metal is allowed. Please plan on wearing metal-free clothing and consider leaving your jewelry at home. If needed, patient lockers can be made available. Please be sure to discuss any questions or concerns you may have with a technologist or radiologist. Prior to the start of the exam, you may be asked to change into a gown. A technologist and a radiologist will work together to perform your exam. The technologist will position you on the exam table to provide the radiologist the best access to the injection sites. You will be made as comfortable as possible. The radiologist will use fluoroscopy, a type of X-ray, to mark the skin overlying the joint to be injected. The area will then be cleansed and a local anesthetic will be injected to numb the skin and surrounding tissues. You will feel a pinch and a stinging sensation as the numbing medication is introduced into the skin. This typically lasts for several seconds. You may feel a pinch sensation when the joint space is accessed. Otherwise, only mild discomfort is typically experienced. A small amount of contrast material will then be injected to confirm optimal needle position. Then a mixture of local anesthetic and contrast, which can be seen with an MRI, will be administered into the joint. After the fluid has been injected, the needle will be removed. This portion of the procedure generally takes about 20 minutes. A small protective bandage will be placed over the site. The bandage may be removed 4 hours after the procedure. You will then be moved into an MRI room where the imaging will be performed. During the move, you will be asked to keep the joint area immobile. MRI is a type of imaging that allows us to see inside the body using a large magnet, radio waves, and a computer. The MRI takes from 30 to 45 minutes and requires you to lie very still. The injection may cause a feeling of tightness or fullness in the joint. Anesthetic injected into the joint is used to minimize this discomfort and may provide important diagnostic information to your doctor. Let your doctor know whether you experience pain relief following this procedure. You may resume non-strenuous activities after the procedure. Avoid strenuous activity for 24 hours following the procedure. There may be mild discomfort of the joint following the procedure. Some people may experience a temporary irritation of the inside lining of the joint, which could result in increased pain following the procedure. These symptoms should improve within 24 to 48 hours and usually respond well to ibuprofen. Avoid aspirin. Some soreness may also be present at the injection site for up to 24 hours. The radiologist will prepare a formal written report that will be sent to your referring clinician within 2 to 3 days. Your clinician will then discuss these results with you. Potential risks include pain, bleeding, infection, joint stiffness, allergic reaction to injected materials, temporary numbness or weakness. As the patient, you are our priority. If there is anything that we can do to make you more comfortable before or during the procedure, please let one of our staff members know. For more information regarding this procedure, or if you have questions or concerns, please call our office at 360-493-4600. You may also visit our website at www.southsoundradiology.com. Thank you for choosing South Sound Radiology.